Good morning. It's Dr. Alejandro Badia with your bi-weekly episode of Fixing Healthcare from the Trenches. And today we are very honored on this Thursday morning to have U.S. Congressman, Dr. Greg Murphy, who is a urologist and happens to be in town for another event. And we got lucky enough to do this, because now we're really speaking to the people who can really make something happen. And we're going to have a short 15 minutes talk about this. Dr. Murphy is a North Carolina guy all the way. Went to Davidson College, UNC Chapel Hill. Go Tar Heels, right?
Tar Heels, right. Amen. Amen.
Did his urology and transplant surgery residency at University of Kentucky. And then transitioned into politics, which he'll tell us about. He was a congressman in North Carolina, and now has been in your third term, I believe.
Yeah. Like a red shirt song.
That's right. So he is congressman representing, I think, the 3rd district
of the coast.
Most of it goes, and my only sibling, my sister, lives in Wilmington.
Oh, does she? Okay,
but,
so we're just north of her.
So you often introduce me to her, Congressman.
That's right.
But no, welcome to Fixing Healthcare from the Trenches.
Absolutely. Thank you very much, and happy to have a discussion.
Thank you. So what transitioned you from being a surgeon, and we talked a little before about all the changes, but now you're really trying to make some big changes?
You try to, and I think that's what I think you and I share that very much. We always just try to make a difference. I had no intention of going to politics. My wife and I have done a lot of mission work. I've been overseas many times. And I didn't ask to go into politics. Our state House member resigned in the middle of his term, and I got voluntold. And
because you had several leadership roles in the county medicine in your hospital.
Yeah, I was chief of staff of our hospital, and
my hat's off to you. I've never done any of that.
Well,
it's a
painful. It's another worm to service, and it's interesting though, because our state house. I've said no, but our medical society really pushed me, because we didn't have a single physician in the entire General Assembly.
Oh, wow.
In fact, the person in the House who was in charge of healthcare was a bail bondsman who hated doctors and hospitals. So,
oh my God,
good old Catholic guilt set in. And so I said, somebody's got to do it. And same thing ended up in Congress. Same thing.
Especially, North Carolina is a leader across the country in healthcare. The research triangle, for those who don't know, between UNC and Duke and Wake Forest and all. It's unbelievable what comes out
right in that area too. So it's a great cauldron.
Yeah, it is.
We just don't talk about Duke very much though. So.
Right. We won't. So those Blue Devils. So how did you transition then into being a U.S. congressman?
Interesting story, because about 15 years ago, I was seeing patients, and our congressman, a fellow named Walter Jones, very good man, came into my office about 2:00 in the afternoon, and I had him on the operating room table at 5. Had a emergency. It would have been really bad. He may have been died in a couple of weeks. Wow. And sad. And long short, we developed a good relationship.
Yeah.
And he developed an illness which he didn't want to disclose, and said he was going to retire at the end of the year. Wanted me to prayerfully consider that. 3 months later, he had passed away from Lou Gehrig's disease, ALS.
Oh, geez, ALS, yeah.
So, I threw my hand in, and there were 26 of us in the special election, and
is that right?
Boom, I popped out. 17 Republicans and a bunch of Democrats and other folks. So
interesting.
Yeah, that was in September of 19. So I've been serving there, and presently on Ways and Means and Healthcare Subcommittee. Same thing on the Veterans Affairs. It's a huge issue in our district, our Veterans Affairs, and so really
finally getting attention, which
absolutely.
I worked in a VA hospital. In fact, I helped pay for residency through Bellevue and NYU by working night shifts in the ER at the VA hospital. So you can imagine.
Yeah.
So thank you for doing that. That's so important. But in terms of House Ways and Means, the public needs to understand that. My understanding, the House Ways and Means Committee really decides on what's being funded and isn't ultimately responsible for CMS, which is Medicare.
Yep.
Right.
Absolutely.
And Vern Buchanan is a leader there.
Vern is the chairman, subcommittee chairman of health, in which I'm a committee member. And we share some responsibilities with another committee called Energy and Commerce about Medicare and about indemnity insurance and some of the other things. So it's a very, very important committee. It was actually the first one ever committee we ever had in Congress.
Is that right?
Yep. It's the only one established by the Constitution itself. So it's a big deal to get on Ways and Means. So I'm very happy with it.
Well, I hope we find a means to do something to fix healthcare, because, you know, all these Medicare cuts, I mean, there's so many other ways to cut costs in healthcare, as you know, but cutting the people actually provide it in an inflationary environment is not. And I'm going to say publicly here, and I've said it, is that I opted out of Medicare late last year.
Yeah.
I felt not only didn't I have a choice in terms of what reimbursement is, but I felt I had to make a statement.
Sure.
I had to take a stand. So I'm sorry to have to do that.
No, it's a
yeah.
tragic effect.
Yeah,
and this is what's happened. You know, we've had a 26% cut in physician fees, inflation adjusted, over the last 20 years in Medicare.
So listen to that. So imagine any of you listening, if a quarter of your salary was actually cut, over a 20-year period. I mean, how many people? Most people change jobs.
Well, you know, I give an example is if you had a hardware store and you had different clients, but you sold a lot of hammers, and it cost you $1 to buy a hammer, but you were forced to sell it by the government to sell it at 40 cents. How long could you stay in business if that was your main thing? And so, you know, I hate it for the patients. Because cutting doctors' salaries is either going to make doctors retire, not see Medicare patients, or turn into a more costly type of employment, and that's hospital or private equity employment. So I say to the private practice guys, fight tooth and nail, stay in private practice. It's the best form of medicine. Well, good. Well, we're trying to do it. And I think there is going to be a backlash. I think we're seeing it now with private equity getting in. I think groups are so how Congressman, or I'm going to say doctor, if you don't mind. Please, just call me Greg. Yeah, I prefer actually doctor to congressman. Okay, good. Well, on this show you will be, and I'm going to ask you if you can name 3 practical measures that you think we could enact to actually lower healthcare costs. What would they be? I think if you look at it in total, what was good about medicine and what's gone wrong with medicine, the number one thing that pops out is the middleman. My God, the middleman. This is what's happened in medicine. I feel like it's an echo. It's unbelievable. Yeah. Well, that's it. That's absolutely the truth. If you look at what's happened with the middleman, you know, in 1965, when Medicare came out, doctors didn't want to do it. And then they said, okay, we'll do it because we take care of people. That's what we do. We take care of people. And it's become such an onerous burden now, especially with the Medicare Advantage plans. Sorry, guys, and I've said this many, many times. Not a fan. Because what's happened with the middleman, and now in a second row, we'll talk about insurance, is I think things were well-intended, and that they were going to give seniors choices, but they're really not. And it was fairly compensated at first. They're cherry picking, and they're through the prior authorization nonsense. Oh, gosh. That goes on. It's really hurting our seniors. Yeah. And so what's happening now? You see companies like United, which doesn't like me very much. They've never come and engaged, making billions upon billions of dollars in profits. When the physician, the person who stayed up in the middle of the night caring about the patient, is the one taking care of it and taking care of the patient. And we have so many other people within that middleman causing the problem. Well, one of the wealthiest guys here in Miami, sold his company. They sell patients like their heads of cattle. And sold, number of patient lives, and sold it to United Healthcare for $800 million. That's just tragic. I mean, it's just tragic. The second thing is regulation upon regulation. And I'll pick off. This is, music or not music. It's sad to everybody else's ears. Is the prior authorization nonsense that we go through. You're having to deal with people that don't know anything what you're talking about, and you're immediately denied. Right. It's like if you put on the road, you put a bunch of nail rails to literally slow you down. And at some point, but those nails cost a lot. Yes. That's the problem. Well, but you're trying to see patients to take care of them. Yeah. And if you're just being pushed and pushed and pushed, at some point you give up. And that's what insurance companies want us to do. Absolutely. Well, now I'm going to call you Congressman. Isn't there some inertia now to diminish that? My understanding is even United Healthcare has said publicly that they're going to be looking critically at the prior authorization and streamlining it. Sorry, I don't believe it. I'm just going to, we're surgeons. We call balls and strikes. That's right. It's what it is. I won't believe it until I see it. Okay. So that was number 2. What's number 3? Yeah. So number 3 is really innovation. This nation has led the world in innovation, in breaking the next, the greatest new cure, this, that, and the other stuff. But with that innovation comes cost. And it's not just cost. We're now living 10 more years on average than we did in 1965 when Medicare was started. Yeah. With 4 to 5% people living into their 90s. Our pyramid, this is one of the challenges. Especially our Medicare pyramid is flopped upside down. At the beginning, there were 4.5 people paying in for each recipient. Now that number has dropped down to 2.5.
Huh.
So it's a real math problem. And it's wonderful. I think that people live longer, but we have to work on living healthier. I'll end it with that way. We have a lot of things going on. Let's live healthier. Let's try to run away from the fast foods and all these other things that are truly poisoning us. Let's get back to really what.
Well, I wrote an article recently about, patients, the public taking some responsibility as well in the patient issues. And, that was an op-ed here at the Miami Herald. And I can tell you that, it certainly had mixed reviews.
Sure.
But the reality is that we are responsible.
I saw a patient. I'll just tell you. I'll end this real. I saw a patient a week and a half ago. She was coming in. She had a high-risk pregnancy, and she was having some blood in the urine. So I was seeing her. She's 22 years old. Was on her second child. Her BMI was 70. She's 5'3" and 398 pounds.
Oh my God.
So think about what that's going to cost the healthcare system. And this person's really not going to have a long life.
Right.
Just
That's
try
sad.
Try
That's
it.
sad.
So,
speaking
I could
of
say
innovation,
a whole lot more, but you and I could
can
talk for hours.
Yeah. So, innovation, just to touch on that, and I'll tell you my 3 very quickly, but the issue with innovation is that it's being a bit stifled because doctors are worried so much and fighting this authorization and all these hurdles. So it ends up, and it's the same thing, right? We were talking about your thumb.
Yeah.
My American colleagues, I feel like we're starting to slip behind some of our colleagues internationally who don't have to deal with these headaches, possibly because they dealt with them decades ago, and now we're facing them. But I'd hate for us to go and become, one of these systems, right? You see what's happening at the NHS in England or our northern friends in Canada. I mean, those systems aren't good either.
No, it's gone backwards.
Yeah.
It's absolutely gone backwards.
Well, my 3 are kind of tie into yours. All right. So I believe we should have oversight, not authorization. So it doesn't mean that we don't make mistakes. There's not some bad apples. We should have oversight, but not these constant hurdles and nails in the road. I like that analogy. The other one is medicine's gotten so complex that the days of sort of the good old GP being able to handle everything are gone. I mean, I think they need to keep us healthy. That BMI of 70, that's what we need them to do. But you need to see the right clinician at the right time.
Sure.
Right. So somebody's got a urologic thing, just get to somebody like you. Right. And that saves money.
Right.
Ultimately. And then the last thing is what we're doing right here. Public education. What I tried to do with my book, with this podcast, in trying to speak to smart people and passing along to the public. The question is that I have is, when will the public care enough about this? Because that's the thing is, on our social media, we do a lot to educate, but you put something with a cute kitten, all right, and it gets millions of hits.
Yeah. And
you get something that affects all of us and the interest. So I'm not sure what it's going to take to have a save the whales moment or a I can't breathe moment, but the public, they're not going to be able to breathe soon.
No, you're right. It's access.
Yeah.
It's access. So
well, thanks for joining us.
Thank you, sir.
Congressman, Doctor.
Appreciate it.
And we'll keep in touch.
Wonderful. Thank you so much.
Thank you. Thanks.